Hospitals are required to make certain that surgeons are qualified before you go under their knife. The reviews are kept confidential. Tonight, the CBS 2 investigators disclose how the process to award credentials at some hospitals apparently failed. Pam Zeckman reports on surgical secrets that can put lives at risk.
They trusted an orthopedic surgeon to fix their aching backs, hips, legs, and arms. But in more than 30 malpractice cases, former patients of Dr. Spiros Stamalos have accused him of negligent treatment that left them permanently disabled and in constant pain, like in the case of Thomas Thompson.
I would come into the room sometimes and he was just laying in bed crying, just sobbing in the pillow. It was so bad.
Thompson's family is also suing Northwest Community Hospital in Arlington Heights for administrative negligence.
This case is about a doctor with a horrific litigation history and yet was granted complete and unrestricted privileges to perform surgery, and that's not right.
Thompson's lawsuit charges that during his 1999 back surgery, Stamalos improperly removed a joint that destabilized his spine.
But in the process, his cutting tool sliced through Mr. Thompson's spinal cord in 3 spots.
Over the next several weeks, Thompson wrote about his constant vomiting, pain, and splitting headaches, and a swelling at the base of his back continued to grow larger.
These are all classic signs and symptoms of a patient who has a cerebral spinal fluid leak. Time and time again, Dr. Stamalos said, "This is normal, go home, you'll be fine."
A medical expert who reviewed the case said Stamalos' preoperative care of Thompson was deplorable, and his postoperative explanations show he doesn't understand anatomy. Finally, doctors at another hospital stabilized Thompson's spine and drained a liter of spinal fluid from his back.
And if you want to get some perspective on what a liter is, you're looking at it.
But it was too late to correct the permanent damage already done. Thompson's decline continued until he died 6 years later.
It was horrible. It was just horrible to watch it.
Stamalos denies destroying the joint or causing the leak. As for all his lawsuits,
I take care of difficult cases and desperate people. And if the people are desperate and it's a litigious society, what do you expect?
By the end of 2003, nearly $4 million in damages have been paid out to a dozen former patients of Dr. Stamalos. But hospitals in the city and suburbs still allowed him to operate.
That's when Stamalos operated on Gail Matucci's knee, initially at Northwest Community and later at Swedish Covenant Hospital. Now Matucci is suing both hospitals for administrative and supervisory negligence.
They clearly failed to do any type of digging into the background of Dr. Stamalos.
Immediately after her knee operation, Matucci charges that Stamalos failed to do a second necessary operation fast enough to correct a serious complication.
There was a 6-hour time frame that he needed to respond, and he didn't.
In this report, a medical expert in the case says Stamalos' methods of surgical treatment were minimalistic and substandard, promoted infection, and caused Matucci's permanent wheelchair-bound condition.
It's ruined my life. It's absolutely ruined my life.
Stamalos denies the charges in her lawsuit and others.
There seems to be a pattern of cases when there's been a mishap, you don't recognize the complications, infections, and slips of the instruments that have caused people disastrous results.
Absolutely not.
Stamalos resigned from Northwest Community Hospital but continues to practice at Swedish Covenant and Lincoln Park Hospital. Spokesman for Northwest and Swedish Covenant said they could not comment because of the pending lawsuits. A spokesman for Lincoln Park Hospital, like the other hospitals, said their procedures for granting and renewing privileges are confidential. Antonio and Diane.
There's a state agency that regulates doctors. What are they doing?
There is, and we're going to report on that tomorrow night at 10.
Thanks, Pam.